Hi, welcome to the YouTube series Study MRCOG Part 1 Jan 2026. I am Dr. Avinash SS, one of the mentor at StudyMEDIC Study MRCOG group. In today's flash revision YouTube series for Part 1, we shall be discussing briefly on inferential tests, and this will be like a question and answer type of flash revision series. Now we'll see first the first question. You can see that this is the first question. If you want to test whether the mean hemoglobin is in the pregnant sample of pregnant women differs from the WHO recommended mean of 11 grams of deciliter for second trimester of pregnancy. That means here you are testing mean hemoglobin, which is a continuous variable in a sample of pregnant women. So you are taking only one particular sample, and we are checking whether the mean hemoglobin from the sample of pregnant women differs from the known hemoglobin or recommended mean hemoglobin of the from the WHO recommended mean. That means one sample is taken and we are comparing it with the known sample. Mean of the continuous variable is compared with the known sample. So it is a one sample t-test, and you can see here. So this is the sample mean, that is around 10.5 grams per deciliter, and we are comparing that with the known population mean of 11 grams per deciliter. So as it can be seen, the sample mean of pregnant women is little bit lesser and the p-value is less than 0.05. So we can infer that mean hemoglobin pregnant women is significantly lower than that of the WHO recommended mean. So when you want to compare a continuous variable between one sample and a known population, to find the significance of the difference in this, we use what is called as one sample t-test. And if the data is not normally distributed, then we use what is called as the one sample Wilcoxon sign rank test. So that is what we will use when the data is not normally distributed. Okay. So the second question is between babies born to anemic versus non-anemic. So here there are two groups. One is the anemic group. The next one is the non-anemic group. What is we are comparing is the mean birth weight, which is a continuous variable. Mean birth weight is a continuous variable, and we are comparing between two independent groups. And the data is normally distributed. In such a case, we use what is called as the t-test. Okay, so when do we use the t-test? When we use the t-test is to compare the contendent sample groups. Sample anemic mother, mean birth weight is 2.5 gram kg. Non-anemic woman, mean birth weight is 2.9 kg. And if you want to find the significance of the difference in this birth weight between non-anemic versus anemic women, you can see that it is lesser in the anemic woman, and it is lesser than 0.01, so it is highly significant. Here we infer it as the non-anemic woman. So in this case, we infer through the t-test. If the data is not normally distributed, then the alternative non-parametric equivalent u-test. Okay, so both are done to compare the continuous variable between two independent groups. Now we will extend this. In this case, you can see continuous variable in different pregnant women across first trimester, second trimester, and the third trimester. In this case, you can see the continuous variable is the mean hemoglobin, and we are comparing it across three different independent groups, women with first trimester. That means more the difference in the continuous variable here in this case is the mean hemoglobin. It is an extension of the independent t-test. So you can see, so hemoglobin is 11.2 grams per deciliter in the first trimester, and it is less in the second trimester and still less in the third trimester. Okay. So the significance of the difference in the mean of a continuous variable between do what is called as analysis of variance distributed in one group or many groups. Then the alternative non-parametric equivalent to ANOVA test is called as the Kruskal-Wallis test. It is called as the Kruskal-Wallis test. So till now we checked about the one sample t-test and one sample Wilcoxon sign rank test, then independent t-test and the Mann-Whitney test, and the extension into three groups, that is more than two groups, ANOVA and Kruskal-Wallis test. Now we will see if you want to significantly increases the hemoglobin level in pregnant women after 4 weeks of therapy. That means compared to the before hemoglobin after 4 weeks of iron using two samples. The samples is the same woman before iron therapy. She has had, for example, mean hemoglobin of 9.8 gram percentage. And after iron supplementation, you can see it extends to increases to 10.8 gram percentage. So the p-value is less than 0.05. We can clearly infer that mean hemoglobin significantly increases groups in which this is estimated are same groups. That means they are paired groups. They are related groups. They are not independent. Okay. So when we want to compare a continuous variable between two related groups, we use what is called as paired t-test. And if the data is not normal distributed, the Wilcoxon sign rank test. It is the Wilcoxon sign rank test. So the next one is, which inferential test you would like to use when you want to assess blood pressure, whether blood pressure is changing pregnancy in the same woman. That means same woman in first point, second point, and third point in the pregnancy, you can see whether the blood pressure is changing. In the when it is we are using here is, you can see more than one two related groups are there. More than two related groups are there. To compare continuous variable between more than two related sample groups. And the data is now is called as RM ANOVA, repeated measures ANOVA. The mean blood pressure is 112 millimeters of mercury in first trimester, 110 in the second, 116 in the third. So there is not much difference. P-value is also more than 0.05. There is no significant change in mean BP across three trimesters in the same woman. If such data is not normally distributed, then the alternative test. So RM ANOVA test, alternative non-parametric test is the Friedman test. Now, if you want to incidence of preeclampsia, so in this category of women, okay, there is, now if you want to do a study that investigates whether the incidence of preeclampsia is associated with BMI category in 250 pregnant women. That means what they are trying to do is whether association is checked with BMI category, whether BMI high or low. That means the incidence of preeclampsia with the, so what happened here is this is a BMI category. Okay. So you can see the BMI category, there are three BMI category. So it's a categorical group. BMI category is a categorical group. So you want to find out the association between two categorical groups. That means whether preeclampsia status is associated with BMI category or whether preeclampsia status is independent of BMI category. That means if you want to test the association or find out the independence between two categorical groups, we use what is called as chi-square test. And here you can see preeclampsia status is significantly associated with obese women. So you can see preeclampsia, more number are present in obese women, more percentage are present is in obese women, right? So in when do we use Fisher-Exact test? So if you want to study an association between RH incompatibility, again categorical variable, compatible or not, and neonatal jaundice present or not. So two categorical burial, but the sample size is less than 20. So if you want to study the association between two categorical variables and the sample size is less than 20, then the alternative to chi-square test is Fisher's exact test. Both are non-parametric tests as they both deal with the categorical variables. So you can see the RH status is categorical variable and jaundice status is another categorical variable. So you can see more RH jaundice is present in more of RH negative. That is, jaundice is significantly associated with the RH negative status here. Okay, so and total number is actually 19, should be less than 19 or 20, but and cell size here you can see is less than 5. That means expected frequency is more than 5 in 80% of the cells. Then we use chi-square test. If this is not met, then we use what is called as the Fisher's exact test. Okay, so more than 80% of these cells does not contain. So this is less than 5. This is cell is less than 5. This cell is less than 5. So you can see more than 80% of these cells frequency count is not more than 5. And even if the total sample size is less than 20, in any of this will meet, then we use Fisher's exact test instead of the chi-square test. Now, if you want to assess whether a prenatal education program improves the use of institutional delivery services among pregnant women. So what they are doing here is whether once you conduct the prenatal education program, okay, before the prenatal education program, whether they wanted institutional delivery service or not. After conducting a prenatal education program, whether they wanted institutional delivery service or not. That is what you are trying to see. That means if there is any change in whether they answer to institutional delivery they want or not, that is the categorical variable before the prenatal and after the prenatal education program. That means, so we are conducting here before and after. So before and after the prenatal education program, whether there is a change in the categorical variable, not the continuous variable. So if before and after, if there is, you want to find out or compare the continuous variable, you do pair t-test. Similarly, if you want to test the difference in proportion or pair in the paired nominal data, that is before and after match test, you do what is called as McNamara test. So you can definitely see out of 25 who said they will deliver in hospital, out of 25 who said they will deliver in hospital before prenatal education, 20 went on to deliver in hospital after. Now, out of 25 who said they will deliver at home before prenatal education, 15 went on to deliver at hospital. So these are the discordant nominal pairs. In such a condition, if you want to find out the significance of the difference in whether the categorical variable changes in before and after type of situation, we use what is called as McNamara test. And if the sample size is less than 25, excuse me, the alternative test is the exact McNamara test. Okay, parity test is for continuous variable, whereas McNamara test is the same criteria, but it is used for categorical variable. Now, these are the other examples of usage of the McNamara test. To compare the effectiveness of two different diagnostic tests, that is ultrasound technique versus MRI technique. Well, ultrasound positive, what about MRI positive? Well, ultrasound negative, what about MRI? That means both are categorical variable, you want to check. And the same group of patients, Okay. So one group, same group patient, the same group patient in one USG finding, in one MRI finding, you are checking. Okay. So USG plus, USG minus, MRI plus, MRI minus. You can see two categorical variables here, but same group. Again, McNamara test. Another example is evaluate changes in patient symptoms, whether urinary continence increases or decreases. That means present or absent before and after surgical procedure. Before surgical procedure, urinary incontinence was present or absent, and after the surgical procedure, whether the urinary incontinence were present or absent in a same woman. So again, categorical variable, whether it changes before and after. This is again McNamara test. So these are the other examples. Now, if you want to study in women with suspected PR women, if 3 bedside tests differ in their likelihood ratio of returning a positive result, that means what is happening here is the bedside tests, whether it is positive or not, is a categorical variable. And here you are checking this first bedside test, second type of bedside test, and the third type of bedside test, whether it is positive or negative, in the same woman, okay. So at 3 different time. So in this case, it is extension of the repeated measure ANOVA test, that is for the categorical continuous variable, whereas Cochrane Q test is for the non-categorical variable, and repeated measure ANOVA is for continuous variable. Cochrane Q test is for categorical variable. Like that you can remember. Other example is tracking the status of anemia, whether anemia is present or not in the same pregnant women, first trimester, second trimester, and third trimester. You can see there is a categorical variable, present or absent, present or absent, present or absent, whether it changes in first trimester to second trimester to third trimester. So it is the Cochrane Q test. Similar, another example is evaluating whether the same set of residents achieve sterile technique in 3 simulation situations. First simulation situation, second simulation situation, and third simulation session. Whether the sterile technique is pass or fail. Whether it changes in the between the first, second, and third type of simulation sessions. Sterile technique. Okay, following up of the evaluating the sterile technique. So again, categorical variable at more than 2 different situations and in the same patients, same group. It is a Cochrane Q test, similar to RM ANOVA, but for the categorical variables. Now, if you want to study if there is a linear relationship between gestational age and birth weight, here you are checking relationship or association. Maybe the strength and direction of the association between gestational age, a numerical variable, continuous variable, and birth weight. Both are continuous variable, and if they are normally distributed, what test you are going to use? We are going to use what is called as the Pearson correlation test. So here we collect the gestational age and birth weight and for around 100. So you can see both these variables, birth weight as well as gestational age, are continuous. And when we are plotting them, you can see